Great, thank you, Trace, and welcome to everyone. It's a great way that we can connect on these webinars, although I'm sure a lot of you are all webinared out. So let's just enjoy tonight. I would like for it to be as interactive as possible. So as Trace said, there is a question drop down. Please, I'll be watching those as I talk, and let's get some questions in. If you're having sort of common things that patients are struggling with, pop them in there and I'll chat as we go. But what we basically want to look at tonight is this sort of shift from office to home space. We've always known that ergonomics is crucial. I mean, just myself within my private practice, even before COVID, the amount of injury that we would see from repetitive strain was huge. And that is because people are behind this little laptop for, 8 to 12 hours of the day. So today we're going to focus a little bit more on home and how we can give some tips and adapt there. But we'll go through just some of the studies and things that we did within office space, which would obviously now correlate to them working behind a dining room table and things too. But yes, as we said, just any questions, please just pop us a little note there, and we will also have a poll later, which you can answer for us. But again, thank you for being here. I have had to laugh at some of the injuries I've seen sort of post-COVID. I've had a lot of ankles from people running around their property during the strict lockdown 260 times to try and complete a 21K. I've had people pull out their backs from lifting pot plants. I've had moms with hip impingements from holding kids for too long, etc., etc. So definitely some new sort of diagnoses that we're making and cause of injury. All right, so this is just a bit of a background, a bit of a study. Please pop questions if you have while I'm sliding through. But what we're seeing is that whether it is at home or whether it's at work, that there's a massive, massive link between pain and repetitive strain and the workplace. So a lot of companies around the world have taken on to good ergonomics, but many companies don't due to cost and things like that. And what we've seen as practitioners is we're just trying to fix, we're trying to help where we can, but if they're not sorting out the actual space that they're working on, the postures that they're getting themselves into, then we're not going to have a sort of prolonged ease of pain. We're not going to be able to just keep treating and keep treating. Obviously, there's finance involved there too for your patients, but why are people in so much pain nowadays? Why are we seeing a massive spike of lower back pain injuries, of shoulder impingements, headaches and chronic fatigue? And it's due to our lifestyles. If you think of back in the day, how people rather would walk to work or the kids would ride to school, etc., it's no longer there. This is just a quick sort of glance at a normal day, and this is pre-COVID. It was a total of 15 hours. So it's not just your patient sitting behind the desk at that laptop. They're sitting to eat. They're looking down cervical spine wise to eat. They're looking down at phones. They're looking down to read. They then look down at a laptop. And there's just endless hours of sitting in that awkward rotated pelvic posture, which is causing these repetitive strain injuries. I think now with COVID, there's probably even more sitting, and that's because they don't have to walk from the underground parking up to their second floor office, etc. They're getting up from a sleeping position and they're just sitting. They're sitting to make breakfast, and then they're behind the laptop sort of until the evening, and perhaps even more so. A lot of your patients will ask, well, what is ergonomics? I've seen this big write-up sort of during COVID about get your ergonomics correctly set up. It's basically matching your environment to the task. And what we see with even us practitioners, just in terms of our bed heights and things, we try to adapt our bodies to the actual equipment as opposed to the other way around. So we really want to implement just some quick and easy tools and tips that we can change instead of our postures having to change to what we're working with. I love this one where it says sitting is the new smoking, because it really is. And I think it's even more of a laugh with the restrictions on tobacco right now. But we have the ability to evaluate our patient's workstation, and I really want you as a practitioner, if you can, to try and look at, you know, where were they prior to your session and what are they going back to after their session. Is there sort of a commonality of injury that you're seeing in their patient file? And let's look around their sport. Let's look around their sort of stress on the injury. Is it perhaps from a sleeping position, from shoes, or from their workplace? These are all things that affect our ergonomics, and not just our office and our desk ergonomics, but just our health in general. We can see here, this was a study done in 2007 already, which is huge because we're now, 13 years later. The sitting duration was increased by 112% for the risk of diabetes, your cardiovascular events you can see there, and a 90% increase due to those cardiovascular conditions, which is, it's huge. We've seen an increase in sort of slow metabolisms, higher blood sugars and things, and it's because people are sitting statically. They're not getting up to go and speak to someone in the office anymore or ask a question. It's all done via this Zoom and via chats and things, and we're just seeing this common increase of effects on the body with regards to their health. So what we would say as practitioners, as chiros, physios, bios, and you all know it, our body is designed to move, but we're not moving enough. With today's age, we sit on phones and laptops and things, and we're not moving. You can feel, perhaps even more so now with COVID, you having to be home a bit more or homeschooling the kids, how suddenly before, when we were up and down with patients a little bit more, we weren't having the niggles, and suddenly the sitting behind a desk or a workspace, these little niggles start to flare, and that is because of the cumulative strain on that area. You will all know this, and some of the slides I will just skip through because we all do have the background knowledge, but one can see that working in a static position, in one position for an amount of time, causes muscle tension, causes the fatigue, a slouching posture. No matter how beautifully built you are, perhaps you're young, fit, and you can sit up straight at the beginning of the day, you are going to see your patients or yourself start to just fatigue and start to get that dominance to the one side. And these are all the things that are contributing to a lot of the injury that we are treating. Obviously, we know that injury and swelling starts, and that's when perhaps they start to go into a pain cycle or a muscle contraction, and the decreased flow, blood flow, and the increased waste, and suddenly they then on your phone asking for an appointment. I think we've seen that a lot of the time people leave it too late, so perhaps they think that, you know, the mild back pain that's occurring is nothing serious, but by the time they've got onto your plinth, we're seeing this massive muscle imbalance. Their biomechanics are all mixed up, and we're then having to sort of start from the bottom and try and work our way to get them just to that ease of pain and that mobility that they once were at. So we're going to have a look at some of the disorders that we've seen, and these have been in studies, these have been within my private practice, and just in general with regards to ergonomics and bad postures. We'll start with the spine. A lot of the time we are sort of assessing and diagnosing spines, and we've seen this massive change in terms of tensions around the spinal column, in terms of the curves. The lordosis is becoming further increased. The kyphosis of the neck curve is becoming increased due to us having to look down constantly for those amount of hours. And one can imagine the muscle strain, let alone nerves and things within that are becoming pinched. I must say that within a lot of our studies, we have seen that sort of spinal related disorders are the highest. You can see here, this was just some percentages that were done of complaints of people who experience pain during the course of the day. And a lot of it was shoulder, neck, head related. And then you can see there is a little bit of sort of elbow and forearm issues. And we're going to talk through all of those as we go along. Let's start at the top of the spine. So a lot of the time we do see patients with headaches. Yes, we have our protocol that we go through, we have our assessments that we go through, but in terms of study of ergonomics, we often seen that these tension and muscular headaches are from, as we said, the factors and the environment that they're working in. Do they wake up with the headache? So have we checked their pillow? Do they say, you know, I go to bed fine, I'm waking up and I've just got a pinch behind my neck? Yes, then one would have to look at their pillow, perhaps recommend something with a concave or something orthopedic for them while they're sleeping. Perhaps they wake up fine and they say, nope, I'm perfect until I get onto my laptop. All right, then what is going on around the laptop? Is it perhaps the glare of the laptop that is shining onto the screen that is causing fatigue within the optic nerve and things? Or is it maybe that they're at an angle with their laptop so they don't have a lot of workspace around them? So for 90% of the day, that neck is angled at an awkward curve or awkward angle, and it's causing the tension and those neural impingements. We need to try and figure out with our patients, where does it start? Is it erratic? Is it coming and going? Again, as I said, we all know the sort of guidelines, checking hormonal imbalances and things, but a lot of the time I'm seeing, particularly with patients, that it can even be just a concentration sort of disorder, that the moment that they are, you know, getting into the work, focusing on the task at hand, they're clenching jaws, they're grinding teeth, and it's due to them being over this funny little laptop. Laptops were designed originally to be taken to the airport so that we can finish off some work, to maybe be taken home to just do one or two things. But unfortunately now 90% of staff members are working off a laptop for their entire day. It was not designed to have that low posture, that neck. You can imagine someone who's even taller, the strain that it has for them to actually be focusing on that tiny screen. And often we put in the laptop at the incorrect position. So they are awkwardly angling the laptop on a countertop or on a desk, and it's causing a whole shift within shoulder issues, neck issues, and that's when they are going to get the pain reception and the headaches and things. So what can we advise them on? Obviously, more movement the better within the spine. We do want them to do the stretching, some strength and yoga and things like that I've mentioned. But let's look at the correct positioning of how they should be working for their tasks that they're performing on the laptop. A lot of the time, people have said, I raise my laptops onto some books. So you can see there that there's a picture with the laptop raised. But then what we're finding is, yes, the screen might be nicely at eye level, but they're then lifting thoracic spine to try and reach those keys. So please, please, please make sure when you advise, yes, it is great for us to get our screen lifted. We always say Google search bar should be at eye level. Often when people are reading on documents and things, they then start to read down the documents and they don't scroll. So if just the top of the screen's at eye level, they end up in sort of a curved posture at the end of the email or the document. So rather Google search bar at eye level, and then keyboard needs to be as low as possible, in line with the desk, in line with their wrists. Don't advise that they put it onto books and then they end up having to lift shoulders to type on that keyboard. If they want to get the screen higher, then try and recommend a separate keyboard. There are great things like the monitor arms, which raise the screen at a nice height, and then we can get it the correct angle. We spoke a lot of the time about glare. So a lot of people say, look, I've lifted my screen to the correct position. I've got a separate keyboard and mouse, but I'm still getting these constant headaches. Have a look at their glare position. Where's that laptop? Perhaps for the start of their day, they've set up a workspace, maybe in the kitchen or dining room. They feel fine, but as that sun changes throughout the day, they now have this bit of a glimpse onto their screen, and that's causing irritation within that optic and occipital nerve, and it's causing those headaches to come sort of mid-afternoon. So have we got our glare right? Have we got our screen height correct? Have we got our laptop nice and close to us, or our keyboard nice and close to us? You can imagine the moment that the keyboard is too far away, I'm going to be extending my arms. Think about holding a pot plant or something out in front of you. It's a lot harder to keep my position there, as if instead of me having maybe the kettlebell, pot plant or ball or whatever close underneath. That's the same for the keyboard. We don't want strain within those shoulders to reach. Sitting at an angle, we see it a lot, particularly in corporate. We saw that the spaces were designed in maybe those L-shaped desks. So people were thinking they need to put their workspace within that corner. At one time or another, they're going to favor one corner or the other. And we then start to see twisting of sort of stabilizers and twisting of shoulders, and they are getting just the general RSIs. Make sure that everything is square. My laptop is squarely in front of me, and my mouse is nice and close to me, as well as whatever I'm typing on, separate keyboard or laptop, and my screen is at eye level. Over COVID, there's obviously been an influx of these Zoom calls and Microsoft Teams and things. I'm seeing a lot of sort of unilateral pain from patients. This is normally that they're either taking calls and then still trying to finish work, and they're obviously holding shoulder to ear and causing huge muscular strain and impingement within the one side. So please advise some headrests, headsets, or some earphones. I'm sure people can just get a cheap pair, but it really makes a difference to put the device down and then rather just have that neck in neutral while they're on that call. I've put some stretches here. You guys all have our stretch cards from a lot of your practices, so please hand them that pamphlet. Let them do these stretches at least every hour. Set a reminder on their laptops or on their phones to make sure that they are sort of remembering to perform them, but they need to get blood flow to those areas that are under strain for most of the day. So you can advise on some stretches. You can advise on checking their vision. So have their glasses been updated recently? Is their laptop at the correct height? Is their positioning at the correct height? And perhaps to have a look at their pillow too. What we've seen secondly is shoulder issues. Now, we all know that a lot of the injuries related to sort of work ergonomics is frozen shoulder with that scar tissue buildup within the capsule, as well as the rotator cuff. With the rotator cuff, it often is that awkward angle of a lot of designers, a lot of architects, and then even just day-to-day users. Are they using perhaps the trackpad on their laptop? So they then have that rotation of the shoulders for most of the day to actually reach that trackpad, or perhaps their mouse, and we literally call it the runaway mouse. It runs off out to the side as the day goes on, so something gets in between me and my mouse, perhaps my phone or water glass or something, and by the end of the day they are so far stretched out to reach the mouse that they're causing massive tension and irritation within that right or left shoulder. So what do we say in terms of avoiding the shoulder strains? We always say to try and keep mouse as close to you as possible. Again, a little app or something on their phone to remind them, where is my mouse, where have I placed my phone, and how far away from me is my laptop. Keep your mouse close to you, keep your keyboard as close to you as possible. And then the height of the chair. A lot of the time people are sitting with their feet on the ground, so they put the chair low so that they can pop their feet down, but then, as I said, they're lifting too high to reach for the keyboard and to type, causing huge trapezius tightness and strain. So rather advise them to put some pillows under their seat if they don't have an ergonomic chair, or pop that gas height up in their ergonomic chair or their office chair and get themselves in line with the desk. So we want our elbows at 90 degrees, and then my hands should be on top of the desk when I'm at that height, so that I'm working over my desk, resting my arms, no tension in my shoulders, as opposed to the desk being on top of me and I'm in that hunched up, closed off position. We've seen quite a lot of wrist issues and questions that come about, that perhaps now that I'm working at home, I'm having some wrist tension. Again, a lot of the time it can be with relation to the height of their chair. So they may be sitting too low and they're then angling those wrists at an awkward position. Using the trackpad, maybe they forgot their mouse at the office and just haven't fetched it yet. It is massive. The funny wrist movement that one uses on that trackpad is causing a lot of impingement within that carpal tunnel. So rather relaxed hand onto the mouse next to them. We say the B on the keyboard should be at your belly button. So that will get me in a nice, relaxed, neutral posture for when I'm typing. Again, a lot of people have sort of maybe something next to their laptop or notes, and they're pushing it over to the side. You can imagine that external rotation of the one shoulder and the awkward twisting position is going to create havoc for the thoracic and the shoulder area. So be at belly button in line with you, screen at eye level, mouse as close as possible, keyboard nice and close. My chair is rather higher than lower, and then they can always pop their feet onto something. Armrests are big. A lot of people say, oh, can't I take these armrests off? But if you can, try and advise that the patient uses their armrests. Reason being is that it then allows them to sit back into their chair. When they want to use the desk to rest, they're leaning onto the desk, and then they often lose contact with the good backrest that they have, and they're causing massive issues within the cervical and the thoracic spine. You can see there, those are some of the risky positions to avoid. Those angles of the wrist or joint, hate that sort of tension and flexion. Try and get it as neutral as possible. A lot of people say, should I invest in one of those gel pads and things? It's a tricky one because there are and were a lot of studies done that the gel pad was actually irritating sort of ulnar nerve a little bit more so. So I would just say rather get your dimensions in terms of where is my mouse and where is the height of my keyboard correct, as opposed to creating some sort of tension within that wrist area. The mouse sort of tips and cues is just to make sure that it's nice and straight. Don't clench the mouse. I often have seen this when I do assessments, that people are so tense when they're working at the task that they're clenching their wrist so toughly with on that mouse grip that's what's causing the tension within those pronators and extensors. So try and relax when using the mouse, and just make sure that the size and design is fitted to the hand. Here are some neck and shoulder stretches that you can advise. Again, we'll send you some pics. We do have the brochures, and you can give those to your patients. A lot of the time with shoulders, I do try and recommend rather sort of the open-chested stretches. A lot of these sort of delt stretches are done in the posture that they're already in. So if it is going to be something that I want them to implement in their day, I'm going to rather do some more active stretches and opening up of the pecs and things so that they're getting some more blood flow and movement within that area. This is a nice one. I'm sure us physios will know this one too, just for our own wrists, but they can do that while seating and at their desk and just getting some movement and some stretch within the forearm. All right, lower back pain, our huge one. Chiros, you are heroes here. I'm sure you've had an influx of it since COVID. We just seen people trying to sit on a little bar chair, and they've made makeshift a workspace within their home, and the spine does not like it. They have no sort of separated area, so perhaps they're sitting at an awkward angle with the kids while doing homework, and it's causing massive strain within the spine. So a study done says 80% of people will suffer from back pain. Please, Lord, let it not happen to us, as we need our bodies for our work. But we often associate back pain with perhaps genetics, perhaps a heavy object, a CrossFit movement, something like that. But a lot of the time it is from the seated position. Our bodies were not meant to be at this awkward angle with the pelvic tilt. It's causing huge disc compression and just deterioration of discs too. There are a lot of studies that are done on that too. So this was a small one that we did in terms of the amount of Newton pressure on L3. You can see there lying on your back, we had 250. Standing, which is great. We'll chat about that a little bit more just now with standing desks, 500. Sitting upright without support, so that would mean you would have to stabilize and hold your spine upright, 700. That's a massive increase already from let's say when they got up in the morning lying on their back. And then bending forward while sitting, which is 90% of our patients, we've shot up to 1,000 newtons on L3. So we now can sort of see and answer why in a lot of the reports we're seeing earlier and earlier degeneration within our patients, sort of disc reports x-ray wise, and it's due to years and years of that pressure and those awkward postures. Obviously, we have the two different types of backache. You have your mechanical, your dull chronic pain, and then your prolapse herniated discs. I won't dive into that just due to time. You'll be able to diagnose and assess your patient. We've mainly seen sort of chronic back pain with regards to ergonomics, and it's due to incorrect chairs, incorrect standing positions, moms and things who've just had babies. We can imagine having something of 14 kilos or a toddler or anything on your hip. It's chronic. It's going to cause imbalance. It's going to cause sort of biomechanical difference. Then when they're expected to sit, they're going to have a dominance now more to the one side. But in terms of chairs and working at home, the main thing that we've seen is firstly height. So as I said, a lot of people don't get the chair to the desk height correct, and then they end up perching on the end of their chair. So what I mean by perching, they're sitting on the edge of their seat. A lot of people who perhaps are shorter, they scoot forward on their seat so that they can get to their workspace, they feel more comfortable. And this is normally because the seat pan is actually cutting off blood flow behind the legs. So it's irritating femoral nerve and it's hitting behind their knees. What would I advise here? Try to add some pillows to soften your seating, or to try and rather have, as I said, have the seat higher, and then they can pop their feet up onto the base of the chair so that they're not dangling, and they using the contact of that backrest. They actually need to remember to push shoulders back and let the spine rest in that position. We saw in that study in terms of pressure on L3, it's not a great position to try to hold yourself up the whole working day. You are going to end up slouching. Dangling legs, what can we do? Just pop a little footrest or some reams of printer paper underneath. Again, compression of nerves, compression at the back of the thighs into hammies. It's going to cause neural issues. It's going to cause sensational issues within the legs. And that is normally because the chair is too high for them. Don't drop the chair, rather just give them something for under their seat. Tucking up and sitting on that one leg, it's a huge one that I see with regards to hip impingements. It's a habit, and it's often that one is too far away from our workspace. So we feel like if we pop a leg underneath, we'll get closer and more sort of on top of whatever we're working on. Rather get a footrest underneath them for the reception of just having the feet at that dorsiflexion is great, but then also bring their workspace closer to them. The moment I've got paper between me and my keyboard, I'm going to feel too far away and I'm going to try and lift the body positioning to get to my keyboard. Crossing legs, another habitual sort of issue that we see in patients. I always say that, again, the receptiveness of having something under their feet will help. And again, getting them at a correct angle. We want our hips higher than our knees. The whole 90-degree angle has had new studies that show it's causing hip impingement. So those hip flexors are too tight if the knee is at 90 with the hip. So I rather want to open up that angle by just lifting my chair a little bit higher or popping some pillows underneath. Gangster posture, it's a big one sort of towards the end of the day, people slouching within their chair. It's causing massive issue within the upper spine too, because one is then reaching for keyboard, reaching for mouse, and they then have lost contact with the lumbar support of their spine. So how do I fix that? Make sure that the seat pan is the correct length. So a general rule is 2 or 3 finger spaces from behind the knee to the seat. They might be doing that because the seat is cutting them behind the knees, so they're changing their posture in order to become more comfortable, but it is then causing an onset of other injuries later on. Twisting, another massive one in terms of back pain. You can imagine that twist, the QLs get so tight, the upper spine has to stabilize the body, so make sure that my laptop is right ahead of me and that I'm nicely relaxed into my armrests. bit more management, you know the drill. Exercise, invest in an ergonomic chair, please, please, please. I know that one would think it's just because we're doing this webinar, but from a physio seeing patients every day, it is so vital. I see patients buying the latest Nike running shoes or iPhone, and I laugh because their chair that they're sitting on is maybe 15 to 100 years old. The investment of an ergonomic chair is going to ensure that the injury is less going forward. It's going to ensure that they have more productivity at work. Many years ago, Ergotherapy did a study. It was with one of the banks, and it was with regards to advice and input into your workstation as opposed to just the equipment. So a lot of the workers were complaining of back pain, their productivity had gone down, and they basically studied that what if we give them just the ergonomic chair, or what if we give them the ergonomic chair and a bit of training, or their current chair but just a bit of training on it. And it's quite interesting to see results. Obviously, the ergonomic chair with training is going to be great, but we need to remember that just setting up what they have at present, what they're using currently, could make a massive difference. So perhaps sending them some articles. We have a webinar coming up on Thursday that you could recommend to your patients, and they can attend that and get some tips and cues on how they should be working. And then another one there, supportive shoes. I just want to have a look here because we have some questions that have come in. Okay, so yes, so if the chair doesn't have armrests, then we do recommend that they rather scoot in as close to the desk as possible and use the desk for support. Again, a chair could have armrests too, like this one here, and they're too wide perhaps, you know, no one's going to be working outright like that. If they can do a little bit of adjustment, that's great. But otherwise, you want to get the chair in as close to the desk as possible, get their whole body underneath the desk so that they can rest onto the desk space, or otherwise to just change postures. So perhaps put their seat a little bit higher, use the arm stabilizers and spinal stabilizers to just float. It's what we call when you're just above your keyboard with no support, and then again change that setup to using the desk, but rather keep those elbows at 90 degrees so that you have good angle in terms of nerves running from shoulders down to the arms. Few stretches, great, that they can do while they're at work. They can use the chair and just to get some nice blood flow. Glutes, we often see glute imbalances because we're sitting on them all day. They don't have to work, but try to get your patients to get up and just do some active stretching and things so that they're getting that ease and that tension that's pulling on SI joints and things to relax. All right, this is my favorite one, the tabletop, and try and just advise on doing it sort of 4 times a day if possible. We spoke a little bit about footrests with regards to lower back pain, but a lot of people think footrests are just for shorter people. It's not the case at all. I did mention that just by having that receptiveness of having the feet onto something at a dorsiflexion, it does create less sort of imbalances further up and bad habits of crossing maybe the one leg over the other under the seat or sitting on the one leg. But it's also just to relieve pressure at the back of the thighs, so into the hammies. It decreases swelling, varicose veins, and just causes a nice open nerve line from sort of into the calf all the way up into the lower back. Paperwork, again, a massive one. We see it too many times that the paperwork is between me and my keyboard. So I'm now got something between myself and where I'm typing, and we then causing a massive incorrect posture with regards to shoulders, neck, and upper spine. Rather get a recipe book holder or something on the side. Keep it as close together as possible. This goes for this, the same sort of tips go for if you're working on 2 screens. We see it too often that the screens are at opposite ends of the desk. So now you can imagine if they're doing that rotation with their cervical spine 380 times of the day, they're wondering why they're getting impingement. Keep the paperwork close to their screen. Keep all screens as close together so that it's just an eye movement that I'm moving across. I know Jean-Marie and her team at the University of Stellenbosch did a great study on the benefits of sit-to-stand desks because it is becoming more popular within South Africa. And we had some good results. So in terms of posture, yes, obviously better than us sitting in this hunched position. We're opening up and we're having to use more sort of muscle contraction while standing. We're burning more calories. And they did see a nice increase with regards to concentration and productivity too. It would just be wise with your patients just to advise on its fitness. So I saw in my practice a lot of sort of patellar tendonitis and again hip imbalance when my patients suddenly got a standing desk, and they'd say, oh, it was great, I now stand for 4 hours, but they didn't build themselves up to that standing posture. So we would say about half an hour standing, 20 minutes sitting, and then half an hour standing, half an hour sitting. So try and get your patients to build up that fitness and that adjustment to their posture. That's why your things like your very desks that are quick up and down are the solution. A lot of people have those desk stands, which is that little wooden unit. It's great that it allows people the option to stand, but often they then have to undo their cables and then retract the little wooden stand, and then it's not at the right level, etc. Whereas your height adjustable desks, electronic or spring loaded, really are great. The same rules apply here. Please ensure that your patients have the screens at the correct heights. Yes, it's great that I'm now standing, but now as a tall person, I'm hunching over even more and leaning into one hip to try and get in line with my screen. Adjust their equipment to their dimensions and to their posture as opposed to their posture to the equipment. Those are some of the benefits that we saw with regards to the study too, and you can see there, I mean, 84% less fatigue. So perhaps a little challenge to your patients is for an hour of the day to go and take their laptop and stand at their kitchen counter. If they don't have the means to buy a sit-to-stand desk, rather get them at the kitchen counter and standing just for 40 minutes and then going back to sitting. There are sort of ways that they can build their own standing desk, just making sure that those rules still apply. Are my elbows at 90? Are my knees nice and soft? A lot of people lock the knees when they stand, or they lean into the one hip. So try and make sure that they're at that correct posture when standing too. We are seeing a lot of increase within ergonomics since COVID. I think people are suddenly realizing now the means of their health and the value of investing. So please, if you have any questions, do ask us. I'll be sure to just send you a quick copy of the slides if Tracy and the ladies can do that, just so that you can share some of the pictures and things. But I'll leave you with one of my favorite quotes, and as a healthcare practitioner, it's just rings so true to me. It says, treat your body like the most amazing machine ever designed, because that's what it is. Fuel it properly, challenge it, give it some rest, listen to it, and be grateful for it every day. And I think if we can just try and advise our patients on that too, let's rather try and avoid the problem as opposed to sort of creating the problem, it would be great.